Dear students, we arrived to the last lecture about the clinical nutrition of dog and cat. You remember that in the field of clinical nutrition we are in number 4, special physiological circumstances, and in this unit we have made the discussion of feeding and the skin, raising and feeding of orphan pups, kittens and foals, and now we will continue with the special diets for senior dogs, cats and horses, feeding of hard-working dogs, and dietetic treatment of tumors in dogs and cats. First, the special diets for senior dogs, cats and horses. And this is, in other words, this is the field of the nutritional geriatrics, and you see that our goal is that old-aged dog and cat, instead of the left state, keep in the right, in a fit state, in a good quality of life. The clinical process of getting old is a slow but progressive decrease of the vital functions, for example, the functioning of different organs. For example, you can see the physical power, the stamina and endurance, respiratory disturbances, capacity of heart and lungs decreases, decreasing kidney functions, limited mental functions, obesity, bone, tooth and joint ailments, impaired immune system, and others like collapse, chronic cough, vomiting, etc. So you can see that the old-aged dog and cat can be considered an animal which has a little bit kidney problems, heart problems, limited mental function and impaired immune system. But as an illustration, you can see also very frequent endocardiosis and the valves in a cat, and right you can see a chronic interstitial nephritis compared to a coin. To the cognitive dysfunction, I can see the drowsiness or somnolence in a 12-year-old Malamute at your left, and right you can see a real cognitive dysfunction in a 70-year-old West Highland White Terrier. She or he was not able to return to the other room, and this is a Alzheimer-like disease in case of the dogs and not in case of the cat. You can see left side the histopathological change, disease and Alzheimer-like disease, and you can see the amyloid plaques which cause the degeneration of the brain. And on the X-ray picture you can see a brain with Alzheimer disease which is shrunken compared to the right, a normally aged brain. These are human pictures, but in dog is totally similar. You can see in a comparison that Alzheimer disease, beta amyloid retention in healthy and sick old man, A and B on the left side. So you can see that even in a healthy old man we have some beta amyloid plaques, but in the Alzheimer-like significantly more. And right side, you see a 86-year-old sick man in Alzheimer disease and a 13-year-old sick dog. Both has a huge amount of beta amyloid plaques. The incidence of overweight and obesity is higher in older dogs and cats, but not in the very old population. You can see the percentage of animals in correlation of the age in year, and the overweight and obese animals are the highest percentage between 6 and 12 years old, and before growing period and young and very old is a declining incidence of overweight and obesity. We have age-dependent changes in articular cartilage and intervertebral discus. The chondrocytes lost their number. There is a fibrillization of the joint surface, and periarticular osteophyte formation occurs. There is a decrease of the cavity of the joint. Subchondral bone sclerosis will develop, and swelling of the soft tissue of the joint as a consecutive process will cause pain. The question arises, when can it considered as old? The decisive is the body size, but of course that this is related to the species, dog or cat, and of course to the breed. The small and miniature breeds below 10 kilograms start to get older from 11 and a half. The medium-sized dogs from 11 to 25 kilogram of live weight start the aging from 10 years. The large breeds from 26 to 45 kilogram of live weight from year 9, and the giant dogs above 45 kilogram of live weight from year 7 and a half. The cats from 11-year-old approximately, but we have exceptions, the Persian, the Simian, and the Maine Coon from year 9 or maximum 10, so they are more sensitive. This chart give you a illustration to the correlation of the age of the elderly state and the live weight. When can it considered as old? It can be seen that the larger the animal is, the breed is, the shorter is the lifespan, because the aging process will start earlier. The physiological basics are important, especially the differences in energy metabolism. In the left, you can see that the average daily energy intake for the maintenance energy intake calculated to surface metabolic body size is decreasing in correlation with the age in years continuously. In this right table, you can see the same in numbers. influence of age on maintenance energy requirement of Labrador retrievers as a typical medium-sized, big medium-sized dog, and this will prone elderly dog and cat for getting fat, because you see that if the maintenance energy requirement will be less and less, and at the same time the physical activity laziness is higher and higher, if the feeding is not adapted to that, there will be a obesity. What about, this was the energy metabolism. What is about the protein turnover and its regulation? What is very important consideration from in the elderly? You have to see that the protein turnover make not a difference, that there is a common amino acid pool, and it will receive amino acids both from the breakdown of the body protein and the protein intake, and the output is a nitrogen excretion by the urine, and there is also a synthesis of the body protein. What is the regulating factors of this process? The main regulating factors, of course, from the anterior pituitary gland, the growth hormone act on the liver, and the liver will produce the insulin-like growth factor 1 and send also amino acid, and will build up skeletal muscle. And also there is a amino acid absorption from the small intestine into the liver. Highly interesting is that the growth hormone production is related to the amino acid intake, and if the amino acid intake is low, the growth hormone production is also low, with a consequence less skeletal muscle building, and also the growth hormone level will control the bone development, so this will also cause a osteoporotic state. Now we see the metabolic changes related to the elderly state. First, in cat, the digestion coefficient of fat decreases by 10-15% point in the old cats. So there will be a less effective absorption of the fat. In the dog and the cat, there is a glucose intolerance. In the young, the glucose metabolism, in case of a diabetic state, go into ketogenic state, production of keto acids and acetone. In the old, in turn, the diabetes is a hyperosmolarity type, and the liver insulin sensitivity decreases, and instead of gluconeogenesis, the fat synthesis may have a dominance. The fatty acids desaturation will decrease, the delta 7 desaturase and others, and the damage of icosa derivates metabolism will result in a prostaglandin E2 and leukotriene B4 increase, which cause a higher sensitivity to inflammation, rather prone to cramps and spasm. And there is a upset of microbiome and sensitivity to dysbiosis. So old animals are prone to dysbiosis. Peculiarities of nutrients, mineral, vitamin, and active substance requirements. The water intake is highly important because the water metabolism is labile, and we have to assure ad libitum drinking for elderly animals. What the energy supply concerns, in case of old dog, we have to give 20% less energy than for the same body weight in a younger age. For the cats, altogether unchangeable because the fat digestibility decreased. In this case, the dry matter digestibility increase and little bit, and the two remain the same. The protein give ideal high biological value protein, and this is substantial new. This is an essential change in approach to the elderly dog and cat and other old animals, even human. No few at all. It have to hint to the relation of protein supply and growth hormone production. So we have to maintain the growth hormone production by high crude protein intake, 30% for the dog and at least 32 up to 40 to the cat. Be careful in case of chronic kidney disease. Of course, we have to be careful. The carbohydrate supply is very delicate. We have to consider the glycemic index, and we have to try to low glycemic index carbohydrates. In the group of minerals, we need less phosphate and sodium. First, we have to reduce the load of the kidneys, and the second, we have to avoid urinary stone formation. So this is important. Also highly important that in case of old cat, please do not use acidification of the diet or veterinary diet which use acidification to prevent the struvite crystal, because too much acidification in old cat will cause oxalate urinary stones. Even if you simply feed old cat with a young cat diet with acidification can cause a problem, oxalate stones. Vitamins give more because the utilization is bad. Exception are the vitamin A and D because of the possible empoisoning. Practical execution and application of these theoretical background is that the glycemic index, what we have to take into consideration is a ranking of carbohydrates on a scale from 0 to 100 according to the extent to which they raise blood glucose levels after eating. Feeds with a high glycemic index are those which are rapidly digested, absorbed, and metabolized, and result in marked fluctuations in blood glucose levels. In turn, low glycemic index carbohydrates produce smaller fluctuation in blood glucose and insulin level, according to the definition of the Sydney University homepage. And here you see a list of glycemic index foods and feed and raw materials, low up to 50, lentil, soybean, bean, milo corn, sorghum, buckwheat, amaranth, quinoa, apple, bran, porridge or oatmeal, milk and dairy products. Medium, of course, that dairy products can have also a glycemic index of the lactose and of the gluconeogenesis of the amino acids. Medium, between 50 and 80 approximately, banana, whole bread, rice, orange, chocolate. And high, sugar, refreshing juices, soft drinks, Coke, boiled potato, be careful, melon, and honey. What type of supplements or additives can be used? Antioxidant, because of the higher oxidative state, like carotenoids, lutein, omega-3 fatty polyunsaturated fatty acids, fish in oil, but be careful because sometimes the fish in oil is in vegetable oil and many times in sunflower oil, and this is not a source of omega-3 fatty acids. The own oil of the fish is okay, and we can give probiotics, for example, yogurt, kefir, or in capsule, the lactobacilli. Mannose oligosaccharide or yeast can be given to use as a competitive antagonism against some gut microbes. The fructose oligosaccharide, both natural in beet, carrot, and vegetable, or the chemical compound, or the fermentable fiber, all of those are able to fix of ammonia in gut lumen. This is the so-called nitrogen trapping to help liver and kidney function, to decrease the load of ammonia towards the liver and kidneys. Natural or synthetic chondroitin sulfate for treating the joints, fat burners like L-carnitine and trivalent chromium against the fat accumulation, and immune stimulant, immune modulant, and nucleic acids can be given. In elderly horses, we have to mention some peculiarities. The incidence of equine metabolic syndrome and the Cushing disease is higher than in the young horses. Here you can see a picture of equine metabolic syndrome, a very special clinical sign, excess adipose tissue on the neck. All the described physiological background and dietary treatment of the old age state is valid for the horse, but we have horse peculiarities. The microbiome is disturbed. This is very frequent, so you have to give a balanced concentrate and hay supply. The oxidant state in the body is very strong, and there is a high vitamin C requirement. It's interestingly enough because a healthy young horse can synthesize sufficient amount of vitamin C, ascorbic acid, but the old elderly horse requires at about between 10 to 20 gram ascorbic acid per day. Now I give a summary of the senior diets characteristics valid for all the animals and a little bit also to the human. Decreasing of energy intake, moderating postprandial glucose and consecutive insulin peak by the consideration of the glycemic index, high selection of the feedstuff, high biological value protein but sufficient, so not reduction of the protein intake, what was told before in the old time. Low salt intake, salt level, high mineral and vitamin level in the senior diet, no acidification, especially for cats. Instead of omega-6 polyunsaturated fatty acids, use omega-3. Use of antioxidants, mannose oligosaccharide, fructose oligosaccharide, chondroitin sulfate, fat burners. And as an extra horse, vitamin C supplementation. Our next unit is the feeding of hard-working dogs, or we can say that the working dogs. What are the working dogs? Working dogs are trained to some special task, and they can have a short period of work, a half day and a 1 day work, for example at the military, at the police, or the dogs helping handicapped person, etc. If you want to put together the ideal feed for work, we can make 3 categories. 1 sprinter, 2 middle intensive, up to 4-hour work, physical activity a day, and heavy work, 8-hour physical activity for day. Our recipes included the more and more popular hard dog race. At your right you can see, and also the hair cursing in some countries is prohibited, in some countries is possible. And not included in these compositions and recommendations, the greyhound dog race to your right and the sled dog race. Now we have to see these 3 categories: feed mixture for work, and the first category is only a little bit improved compared to a healthy dog average feed mixture. Metabolizable energy, megajoule per kilogram dry matter, 16, crude protein 28, ether extract 10, and of course that pre-treated carbohydrate, nitrogen-free extract 65. The medium category requires more energy, so it is 20 megajoule metabolizable energy per kilogram dry matter. This can be achieved by increasing the fat and oil from 10 to 30% instead of carbohydrate. And you see that the crude protein has been a little bit increased. To tell the truth, the physical work don't need extra protein. It is a energy requirement, but a little bit of plus may improve the performance. And the number 3 category, this is the hard work, the metabolizable energy per kilogram dry matter is up to 24. How can we achieve this number? We have to go up with the fat and oil up to 50%. It's really high. Of course that in this case the carbohydrates will drop at about below 15%. What about the crude fiber and ash? These numbers are maximum numbers. This 2% crude fiber is necessary for the health state of the gastrointestinal tract, but we cannot go up. And what about the ash? If the ash is more than 4, we can suspect that the raw material contains bone or feather, and this is not the best for these purposes, because the digestibility of the raw material, the raw components, and also the nutrients should be minimum above 80%, but in the third category even above 90%. Which components can be used? Meat, fish, viscera of mammals and poultry, whey powder, and heat-treated cereals, pre-treated cereals. The heavy work and the muscle activity will produce a lot of free radicals. So we need supply antioxidants like we supply with vitamin E, selenium, and also we give omega-3 fatty acid to improve the performance. Here we will finish this unit with a picture of the Iditarod, which is a sled dog race, more and more discussed by the animal protectionist, and we will continue with the last topic, dietetic treatment of cancer in dogs and cats, but this will be in a larger approach, not only the cancer but all the tumors will be included. Model of the tumor and cancer research, I will show you the naked mole. The naked mole practically does not receive tumor. This is a one gene based inhibition of the tumor growth. They have giant hyaluronic acid, and by the cell reprogramming they can avoid the tumor building. Later this gene was successfully transmitted into mice. This is promising. The second special species to research of tumor development, cancer development, is the blind mole rat. They defend against tumor using a different mechanism. if the cell density reaches a certain threshold concentration, a collective interferon beta release occurs and mass apoptosis will kill the cells. In the slide, after Dante Alighieri apologies, this is not the 7 circles of the Inferno, but the circles of the metabolism. And I draw your attention to the Krebs cycle or TCA cycle and the Cori cycle, because this have a key role in the difference in the functioning of the healthy and tumor cells. You see that in the normal cells, from the glucose through the glycolysis, first pyruvate, and after through the TCA cycle, 38 ATP will be produced. In the cancer cells, the glucose can go through only the anaerobic part of the glycolysis, and from the pyruvate, lactate will produced. The supply of TCA cycle is through the glutamine. Glutamine will be transformed into glutamate and alpha-ketoglutarate. Of course, the efficiency of this later is less than the normal cell's energy gaining metabolism. The pathophysiological changes related to the biochemical changes are insulin resistance, which in the tumor cancer patient, which will decrease the carbohydrate utilization. Therefore, there is a higher glucose level in the blood, hyperglycemia, hyperosmolarity, trouble in liver function, and you have seen that lactic acid production. And lactic acid is an acid prone to inflammation and acidosis. The fall of appetite is caused by the production of tumor necrosis factor alpha. The redistribution of amino acid by liver will change. The production of acute phase protein is different compared to the production of normal life proteins, and there will be a cell-mediated immune answer and gluconeogenesis. It means that production of energy from amino acids. This is at the same time a lean body mass decrease, because muscle protein is used, and the end phase is the cachexia. This cachexia can go up to the stage of Giacometti's bronze dog statue, but in the clinical life you have to evaluate the muscle mass according to this chart, and unfortunately the severe muscle loss is typical for the cancer and tumor. Strategies of tumor treatment are different. You can see a summary on this picture, but we have to concentrate on the dietary treatment. It should be personalized and according to the cell type. We have to make a decision: is the patient operable, is under therapy, or it is the end phase. We have to find and search the dietetic anamnesis, what is given, pet food, homemade diet, how many times, how many, and what is the scheduling and the way, and what is the body condition score of our animal. We have to ask follow-up by a dietary diary, and from time to time we have to re-evaluate these factors. The goal of the dietary treatment, if the tumor is operable and the condition of patients is good, inhibition of metastasis, decrease of the danger of metastasis and recidives after the operation. It means that this is in the pre or post-operative phase. The motto and the slogan is starve, famish the cancer tumor cells. The theoretical basics for that is, I hint to the biochemical background, that the tumor tissues have potentially higher energy, protein, mineral, vitamin requirements than the healthy tissue. To summarize these according to the nutrients, carbohydrates, Warburg effect means that the tumor cells can use only the anaerobic way to gain energy, as you have seen before, which in turn is only 1/8 that of the oxidative phosphorylation. From fat and oil, the energy utilization is slow and difficult for a cell. For the rapid growth cells, like the tumor cells, need continuous amino acid, mineral, and vitamin supply. In rats and dog trial confirmed that before and after operation, a drastic feed limitation, 1/4 of the maintenance energy, should be given. This is metabolizable energy, megajoule, 0.13 times the metabolic body size. This is approximately 100 gram pet food or veterinary diet for dog of 30 kilogram of live weight. This is a drastic feed restriction, but decreases the life expectations of the tumor cells. Combined with irradiation and chemotherapy, may minimalize metastasis and recidives. The second situation, if tumor is inoperable, the aim is prolong the lifespan, assure a good life quality and pain control. Maintenance of the life quality, we have to maintain the life quality, we have to give much protein of good biological value, extra arginine and biotin. Biotin help in neutralizing ammonia, and antioxidants like vitamin E and selenium. Of course, immune stimulating additives are also preferable. What to feed? Carbohydrate, very, very small amount, less than 25%. Fat and oil, more, 25 to 40% of the dry matter. Omega-3 fatty acid addition, minimum 5% of the dry matter. And omega-3, omega-6 fatty acid ratio 1:1, maximum 1:3. Some details about the feed composition, much more protein, especially for cats. Arginine level should be increased, at least 2% of the dry matter. Extra glutamine should be given to improve the condition of the mucous membrane of the gut. Instead of methionine as a sulfur-containing amino acid, we have to prefer the homocysteine. The basic amino acids like the phenylalanine and tyramine should be kept low, and more glycine may decrease the toxicity of the chemotherapy. Which active substances may be beneficial? More selenium and zinc, less iron. This is oxidative. The biotin may support the urea cycle. More antioxidant should be given to inhibit the nitrosamine reaction, which is a cancerogenic. Immunomodulant and included nucleotides help the protection of the organism. The L-carnitine will improve the functional capacity of the liver as a part of the L-carnitol transferase. And finally, by giving hydroxy beta-methylbutyrate by a nutrigenomic way, it can inhibit the muscle degeneration. And this is the end of the dog and cat dietetics. Thank you very much for your attention.